Rape is a forced sexual intercourse, including vaginal, anal, or oral penetration. Penetration may be by a body part or object. Regardless of age or gender, sexual violence and rape robs people of their safety and security. As a result, it's common for people who have been targeted to struggle with trust. They may also question their judgment, their self-worth, and even their sanity. The sexual act may also be considered rape if it satisfies any of the following. One or both people are not old enough to consent, meaning one or both of them are below 18 years old. One of them does not have the capacity to consent, meaning one of them may not be in his or her right mental and legal capacity to consent. For example, people with mental disability, people who have been drugged or unconscious, etc. One of them did not agree to take part. The rapist may have used physical force or threat to force the victim to have intercourse with him or her. If one of these three considerations are met, the sexual act falls under the category of rape, which is a criminal offense and it is punishable by law. Some reasons why individuals commit the rape are substance abuse, including alcohol, anger, sadism, pleasure in doing so, associated or exposed to an increased incidence of violence or gang-related activities, peer pressure and influence, low ethical standards, the desire to assert dominance, unrequited and uncontrolled sexual attraction, conflict and tension within an intimate relationship, couple, or marriage, to correct a person's sexual orientation to reinforce gender stereotypes, jealousy, the presence of economic, educational, and employment disparities between men and women to an interior of an intimate relationship. Clinical psychologist Nicholas Groth has described several different types of rape. A detailed conceptual analysis shows that objectification might underlie denial of agency and personhood that leads to rape. Anger rapist. The goal of these rapists is to humiliate, debase, and hurt their victims. They express their contempt for the victims through physical violence and profane language. For these rapists, sex is a weapon to defile and degrade the victim. Rape constitutes the ultimate expression of their anger. This rapist considers rape the ultimate offense they can commit against the victim. Anger rape is characterized by physical brutality. Much more physical force is used during the assault than would be necessary if the intent were to simply overpower the victim and achieve penetration. This type of offender attacks their victim by grabbing, striking and knocking the victim to the ground, beating them, tearing their clothes, and raping them. The experience for the offender is one of conscious anger and rage. Power assertive rapists. For these rapists, rape becomes a way to compensate for their underlying feelings of inadequacy and feeds their issues of mastery, control, dominance, strength, intimidation, authority, and capability. The intent of the power rapist is to assert their competency. The power rapist relies upon verbal threats, intimidation with a weapon, and only uses the amount of force necessary to subdue the victim. The power rapist often will assume that the assault was not an assault because of their rape-supportive attitudes. Power rapists are often in a mindset that they are entitled to their own pleasure regardless of the victim's feelings or lack of desire. There is a clear tendency for a rapist to have fantasies about sexual experiences and assume that they are enjoying it or grateful for it, even when they resist. Because this is only a fantasy, the rapist doesn't feel reassured for long, either by their own performance or the victim's response. The rapist feels that they must find another victim, convinced that this victim will be the right one. Hence, their offenses may become repetitive and compulsive. They may commit a series of rapes over a short period of time. Sadistic rapists. These rapists have a sexual association with anger and power, so that aggression and the infliction of pain itself are eroticized. For these rapists, sexual excitement is associated with the inflicting of pain upon their victim. The offender finds the intentional maltreatment of their victim intensely gratifying and takes pleasure in the victim's torment, anguish, distress, helplessness, and suffering. They find the victim struggling with them to be an erotic experience. The sadistic rapist's assaults are deliberate, calculated, and pre-planned. They will often wear a disguise or will blindfold their victims. Prostitutes or other people whom they perceive as vulnerable are often their targets. The victims of a sadistic rapist may not survive the attack because for some offenders, the ultimate satisfaction is gained from murdering the victim. Rape can affect the victim's physical, emotional, and mental health. There are traumatic, life-altering experiences that can leave people feeling confused, vulnerable, ashamed, and alone. Yet shockingly, it happens more often than people might expect. Many survivors face extremely difficult and painful emotions and may recall traumatic experiences. However, if a survivor's reactions do not match common responses, such as no physical injury, it does not mean what happened was not sexual abuse or assault. Rape can not only be detected through physical means. We will know more about what are the possible effects of this horrendous crime on the victims. Common physical injuries sustained through rape: bruising, wounds, bleeding, vaginal or anal, difficulty in walking, soreness, broken or dislocated bones, sexually transmitted infections and diseases, pregnancy. Common mental effects of rape: post-traumatic stress disorder (PTSD), including flashbacks, nightmares, severe anxiety, and uncontrollable thoughts. Depression, including prolonged sadness, feelings of hopelessness, unexplained crying, weight loss or gain, loss of energy or interest in activities previously enjoyed, suicidal thoughts or attempts. Dissociation, including not being able to focus on work or in schoolwork, as well as not feeling present in everyday situations. Common emotional effects of rape: changes in trusting others, anger and blame, shock, numbness, loss of control, disorientation, helplessness, sense of vulnerability, fear, self-blame or guilt for quote-unquote allowing the crime to happen, feeling that these reactions are a sign of weakness. What else could someone experience after a sexual assault or rape? Other circumstances can develop for a survivor after being sexually assaulted or raped. A survivor may develop a negative outlook and feel damaged or unworthy of a better life. Drug or alcohol abuse may also become an issue as a way to cope with the overwhelming feelings. Women may also have trouble with their menstrual cycle and fertility. In addition, survivors may experience chronic fatigue, shortness of breath, muscle tension, involuntarily shaking, changes in eating and sleeping patterns, and sexual dysfunction. There are many ways to prevent or avoid being a victim of rape or sexual assault. The first one is ensuring your safety. On the streets, travel in well-lit, well-traveled areas. If possible, know your neighborhood. Be aware of the nearby businesses, their hours of operation, and their locations. Walk in pairs. Walk facing traffic. Avoid shortcuts, bushy areas, and alleyways. Dress for ease of movement, and if possible, don't carry a purse. Don't burden yourself with bulky packages or belongings. Walk assertively and maintain a sharp awareness of your surroundings. If you sense you are being followed, immediately cross to the opposite side of the street and head for the nearest open business or occupied dwelling. When seeking help from the occupant of a residence, yell fire as opposed to help, rape, or murder, and use any means necessary to draw attention to the situation. In the home, install good locks and eye viewers. Never automatically open your door without knowing who is on the other side. Talk through the door. Don't rely on chain latches and screen doors for security, as they are no barrier to intruders. Don't list your name and address so easily on things that can be noticed around the house, like phone books and mailboxes. Verify and have someone present whenever a service is performed in your house. In your vehicle, lock the doors and roll up the windows whenever you leave or in the vehicle. Park in well-lit and populated areas, especially if you feel like being followed. Be aware of your surroundings as you walk through parking lots. Suspects often hide between parked cars. If your car breaks down, raise the hood and turn on the emergency flashers. Remain in your locked car until help arrives. If someone stops to offer assistance, ask them to send a tow truck or to contact local law enforcement. Talk through the window. In a social situation, when first meeting a new friend, exchange phone numbers, not addresses. Keep someone informed of your whereabouts when dating someone for the first time. It is a good idea to refrain from going to bars and clubs alone. However, should you choose to do so, have your own transportation available and use it. Don't allow alcohol or drugs to cloud your common sense. If someone persists in asking for your phone number and you feel it would cause a problem if you refuse, give him a phony number. Know what your personal social standards are and stick to them. Don't allow your judgment to be overruled by an aggressive pursuer. Secondly, learning passive or active self-defense. Passive self-defense. Talking your way out of a situation. Telling the rapist you're pregnant, menstruating, or afflicted with a communicable disease can be an effective ploy. Faking submission and waiting for an appropriate opportunity to make an escape. Urinating, defecating, or vomiting. Note that initiating a passive defense may not work in all situations. If it fails, you can then escalate to an active defense. If you choose to fight or active self-defense, fight effectively. Be aware of your own capabilities or limitations and give thought or have some idea of what you intend to do should you be attacked. You can also take up self-defense classes, and do remember that you can also use your voice as a defensive tool to bring attention to yourself. You could also use self-defense devices such as a whistle, shrill, or a mace. Just to note, for these devices to be useful, they must be immediately accessible should you be attacked. If left in trunks, desk drawers, or buried at the bottom of a purse, they will not help you in an emergency. happen to become a victim of sexual abuse, consider starting your path towards self-healing. The trauma of sexual assault can leave survivors with physical, emotional, and psychological wounds. Each survivor has different experiences and needs, and may process and recover from trauma in their own way. According to Jessica Klein, a senior lecturer in the USC Suzanne Dworak Beck School of Social Work's Department of Adult Mental Health and Wellness, who also specializes in the clinical treatment of sexual trauma survivors. These are the 6 steps that every survivor should take in the aftermath of an assault. After the experience of sexual trauma, the first and most important factor should be prioritizing your safety and well-being. In the immediate aftermath of an assault, most people experience shock, derealization, and a sense of being overwhelmed. After an assault, the limbic system, the part of the brain responsible for processing emotions and triggering fight or flight reactions to perceived threats, is thinking everything is a threat. To establish a sense of safety and normalcy, survivors are recommended to use any coping mechanisms that help them feel comfortable in the face of major stressors in the past. It can mean calling your closest friend or trusted family member to come over and stay with you, or getting under layers of blankets, whatever. Once you feel more physically safe, it's important to connect with a person you trust for support. It is recommended to find a person who will not pry into the experience, but who is there to say, "I am sorry this happened to you. Are you feeling safe? How can I help you?" Some victims may even engage in self-destructive behaviors as a way to cope, but these things do not have to be the reality for you. Many people find that therapy and support groups are useful in their recovery. For instance, both are often non-judgmental spaces where you can talk about and work through any challenges you are experiencing. Therapy is also useful if you are experiencing depression or having thoughts of suicide. When selecting a therapist, make sure the person is experienced in helping victims of sexual assault and rape. It's perfectly acceptable to interview a few therapists or have a few sessions before finding the one that fit. If you prefer to express your experience and emotions anonymously, call a crisis hotline such as the National Sexual Assault Hotline. Hotline operators are trained to offer support, hear your story, connect you with the resources for treatment, and provide you with information on how to report the crime. Many survivors may be reluctant to pursue medical attention in the immediate wake of the sexual assault. It is ultimately up to you to decide what to do with your own physical, psychological, and emotional needs. Choosing to go to the hospital or a medical rape center after an assault can be beneficial for a number of reasons. Most critically, healthcare practitioners can treat bodily injury and help ensure your sexual and physical health. Additionally, they can provide you with a rape kit, a sexual assault forensic exam that can be used to collect DNA, blood samples, and other evidence. If you are not ready to file a police report immediately, some centers can freeze the evidence and store it for later access. In addition to collecting evidence, they will test you for sexually transmitted diseases and can provide you with post-exposure prophylactics to help prevent HIV. They can also provide you with emergency contraception to prevent pregnancy if you want. The desire to simply avoid addressing or processing the incident is a common phenomenon among survivors, but healing doesn't happen through avoidance. You can't go around it, over it, or under it. You can go through it. Learning healthy coping habits, which may be as simple as journaling, walking, or meditating, can help survivors effectively process their trauma. Though not every survivor needs therapy, many display symptoms characteristic of both acute stress disorder and post-traumatic stress disorder. Many survivors doubt their own intuition even though they logically know that they were assaulted. Paralyzing anxiety can make them wonder, was it my fault? Was it actually consensual? This sense of guilt can worsen the negative psychological effects of trauma. As such, therapy may provide an effective forum for mediating, understanding, and coping with your emotions. Seek out a clinician who is specifically trained to address sexual trauma. Memory is dynamic and changing, and each time you remember an event, your brain forms new associations, thereby modifying the memory. As such, therapy can provide a safe space to remember your sexual trauma, and over time, can decrease the negative psychological effects associated with this exercise. Decide if you want to talk to the police. Though you are not required to report it unless you want to, it is 100% your decision. However, some survivors indicate that filing a report allowed them to regain a sense of control over their lives. If you do decide to report what happened, you may want to take a friend or relative with you for support. There are many reasons survivors may not want to pursue legal action. A major consideration for most victims is the fact that their assaulter was someone they know and with whom they may share mutual friends, family, or acquaintances. In fact, a staggering 70% of sexual assaults are committed by a person the victim knows. As such, survivors are often plagued with anxiety, shame, and fear of what others will think. The prospect of reliving their trauma by filing a report, speaking with law enforcement officials, and possibly testifying against the perpetrator in court can also discourage victims from coming forward. Those who have had negative experiences with the police in the past may distrust law enforcement, which can also deter reporting. If you are struggling with how best to support a loved one who has been assaulted, it is recommended reinforcing to the survivor that they have options, even when they feel trapped and completely powerless. Assault is someone taking away your power. Returning that power to the victim often means encouraging them to proceed, however feels the most empowering to them. This might mean filing a report, telling their story, or seeking justice by their own volition. Until you process your trauma and learn how to actively cope, it can be difficult to feel like yourself again. You can regain your sense of safety. You can learn to trust again. And most importantly, you can heal and move on with your life. Consider the activities and social outings that you might have avoided in the aftermath of your trauma. Stay attuned to your emotions and evaluate if you are ready to go back to that exercise class or join your friends at a party. A little internal nudge can be good, but never push yourself too far to be social when you aren't ready yet. Take everything day by day. Group therapy can reduce fear, alleviate depression, and have other positive psychological, emotional, and social benefits. Having the support of a community that understands what you have been through can be a crucial factor in your long-term recovery. If you or anyone you know has been a victim of sexual abuse or sexual assault, please visit Rape, Abuse, and Incest National Network for more information. Before I end this video, remember that no matter what route to recovery you take, it's important to remind yourself that what happened to you is not your fault. You are not to blame and nothing you did caused this to happen. It was a choice made by the person who assaulted you. And more importantly, there are people out there trained to help you. Make sure you reach out and accept it. Recovering from rape or sexual assault is not something you should try to do alone. With patience and persistence, you can heal and move on with your life. This is the end of my video, and I hope that you are in good health and continue being so, in body, heart, and mind.